Uh, Hello, we are meeting today to get to know Dr. Shishir, who is one of the pillars of our course. So tell us a little bit about yourself, Dr. Shishir.
Hello, everybody. Hello, sir. I'm Dr. Shishir, as you just mentioned. I'm a pediatric intensivist working in the Al Sabah Hospital, Ministry of Health, Kuwait. I've been working here for the last 10 years. Previously, I was working in Bangalore in this PICU department in the BGS Global Health Super Specialty Hospital. Um, Coming to what I do currently with respect to the academics, I do teach here the postgraduate students from the Kuwait Institute of Medical Science. And coming to the MRCPCH, I had come in contact with Dr. Anil Sir in 2019 for my clinical course in Kolkata. Previously, I had just finished my part one and part two, and since then, I have been associated with Dr. Nilsa. Uh, I think I'll take it
Yeah,
forward
so
later,
interesting.
the
So
rest of the
tell, tell
things.
us, tell us, Shishir, how has MRCPCH helped you in your career?
Yeah, frankly speaking, I must really tell that after clearing my uh, clinicals, my communication has really changed to a very great extent because communicating to the parents in the intensive care, as you all know, is not that very easy because on a daily basis you're talking to the parents the condition which may not be always on a brighter side. So previously I was I'm sure because I know myself how I have changed. So because previously I was not that good communicator because I've trained my post graduation in India, and then there is no emphasis on the communications to the parents. I believe I am not sure the scenario might have changed now, but uh, after the clinicals, with respect to how to communicate, Dr. Anil sir has changed my entire communication scenario altogether, because now I have become more compassionate and I do listen to the parents and try to answer their queries and then take it forward from there, which I was definitely not doing it before.
That sounds great to be able to connect to parents better because communication is the foundation of what we do with our parents, how we talk to them, and how we relate to them. Right. Okay. So if we have a number of doctors who want to be pediatricians of the future to follow you and follow me, then how would you suggest they prepare for the exam? Briefly.
Uh, yeah, pediatricians at the first instant they have to be having that instinct towards the kids that they can handle them. You need to have first patience because always you may not encounter children who are happy go lucky. Most of the times you will get to have kids who are very cranky, who may not come to you easily for your examination. They may not cooperate, which actually is one of the part being tested in the MRCPCH examination as well when it comes to the clinical stations. So those who have cleared their masters or the diploma national board in India, it becomes a little easier for them to clear the part one and part two because the clinical questions and all will be easier for them to answer. But coming to the students who are MBBS graduates, it might be a little tricky because you would not have read much of the pediatrics in your undergraduate curriculum. So that is where we come in. So we are having a course on part one and part two. The part one is FO, P and TAS, and the part two is the AKP, which is Applied Clinical Knowledge. Yeah.
Right.
So
Okay. So, Shishir,
yeah,
so what did you read? I mean, we will guide them, obviously. So, how would we guide them and help their journey to become members of the Royal College of?
Y- yeah, I feel we can start that journey in the coming future soon. So what we'll be doing is uh, we will have few questions of the part one and part two. Initially, the part one discussed, and then we will give the theory surrounding these questions, which will be discussed with them. So the materials for this course and the materials for the exam will be discussed in the classes, and how to approach each MCQs. I know, I'm sure that most of you have done the MCQs with respect to the postgraduate entrance or the super specialty entrance, or even the MRCPCH part one or part two MCQs. So uh, I think the work is a bit easier for us because you have come across all these questions. So what we do is we just give you some help how to tackle the MCQs
Okay.
options.
So, as I see it and as I understand, Shishir, that the doctors have to do the reading themselves. There is no way out of it. If they have done a postgraduate exam, it will make it a bit easier. Uh,
Yeah.
and because MRCPCH is a different format to what the MD or DNB are, uh, the student would need guidance.
Yes, sir.
And our faculty with extensive experience would be able to nurture them along to their dream. Is that,
Yes, sir.
yeah?
Absolutely. Yes, sir.
And we will have a list of what they should read. And then for each topic, we'll be there to guide them and discuss why and how to attempt the various MCQs, and then subsequently, when they go for the clinicals, how to manage that.
Yes, sir.
Yeah,
Yeah.
great. Okay, thank you.
Thank you, sir.
So let me, one second.